House is in session. Member for St. Peter.
Thank you very much, Mr. Deputy Speaker. Like my neighbour in St. Michael South, my neighbour in these chambers, I'm going to be brief. I believe that politicians can be honest, Honourable Member.
He's poor for half an hour.
I think it is important, Mr. Deputy Speaker, that I join the debate to give support to this Queen Elizabeth Hospital Amendment Bill. I believe it is important to add my voice to this debate because, well, for two reasons, two principal reasons. There are a whole swath of reasons, a range of reasons, but two principal reasons. One is that the Queen Elizabeth Hospital is concerned with health care. And health care is in a world where people get sick. Health care is of critical importance to any society, to any country. And so I would want to join the debate for that reason. I also want to join the debate because health care in Barbados consumes a significant portion of this country's gross domestic product. A significant portion of everything that the country earns or produces is spent delivering health care to those who are in Barbados. This government and this party has always believed that good health care should be available to everybody. We do not believe that if you're living here and you're a CARICOM neighbor, that you should be excluded from access to health care. And I'm using the term access because if you tell me, Mr. Deputy Speaker, that there are clinics all over the place that are going to charge me thousands of dollars, then while the health care is available, it may not be accessible. And that is why this party was not very amused when a previous Minister of Health, no resident in the United States, well, no attached to the United States, I don't know if, well, something, I'm not sure, but no in the United States. When that former member took the position that because you were not born here, good health care should not be accessible to you, that for us was an inhumane approach to governance. And I believe that the people of this country would have come to that conclusion, in some cases late, but they would have come to that conclusion and they would have done what was necessary to move the process of reversing that decision along. Now, I understand that a public healthcare institution, state-owned, like the Queen Elizabeth Hospital is not a for-profit business necessarily. But I'm of the firm view, and maybe it is because of my background, I believe that the approach to leading and managing the Queen Elizabeth Hospital must, while it is not a for-profit business, must take a business-like approach. And I agree with those who would have indicated earlier that a government's decision to make the Queen Elizabeth Hospital or make the arrangement for its administration to be run by a board as opposed to out of a ministry would have understood that there needed to be that kind of approach to the provision of health care for the people of this country. We would have known, And I think it was made very, very clear when we, during the estimates and budget debate of earlier this year, this calendar year, when the Ministry of Health and Wellness occupied the well of this honourable chamber. And my recollection is that between the leader of the opposition, the honourable member for St. Michael West, and the honourable member for Christchurch West, I don't know what is it but West, but those two honourable members were so, let me use the word thorough, in their grilling, that the observation made earlier, the then leader of that organization seems to have disappeared. That itself, along with the disappearance of others who formed the leadership of the organization at that time, is clear indication that there were significant challenges in the leadership of the Queen Elizabeth Hospital. Because people don't just walk away from careers. People don't decide on a whim that they're going to give up their jobs. People normally try to fight it out, but the responses we got indicated that there was something rotten in the state of Denmark. And so, because we recognized Hamlet, having recognized that, a government that is progressive, like ours is, took a decision that we had to do whatever was necessary to right the wrongs, to move the organization from a state of inefficiency, ineffectiveness, what some people refer to as corruption. I say what some people refer to because I have not been given the evidence. I've seen the gloves and I've heard about the receipt. And for me that's enough, because the honourable member who brought that is a member who I've known from my school days to be an honourable man. So there was something wrong that needed to be corrected, and this government took the decision that we had to correct it. And Mr. Deputy Speaker, I want to suggest to you, to this chamber, and to the country that in the midst of an economic recovery and transformation program, in the midst of striving to achieve certain targets of economic performance, that a government could still at the same time focus its attention on the process of making the administration of the Queen Elizabeth Hospital better, of improving the leadership and the management, is testament to the focus this government has on doing the people's business. And I want to say to you, Mr. Deputy Speaker, that our approach, very well enunciated by the Honourable Member for the City, should say to every Barbadian that the way the Honourable Member for St. Michael North East has allocated her resources, the resources available to her, speaks to a vision, but it also speaks an understanding that there's a lot of hard work to be done, a lot of heavy loads to be lifted, and that each of us who she is asked to be on the team needed to be able to focus on the task at hand. And I want to commend the Honourable Minister, the Honourable Member for the City, for that laser-like focus that brings us to this Honourable Chamber today to debate these amendments. Now, anybody who is involved in any kind of organization, it doesn't have to be a business, it could be a club, it could be a school, but anybody involved in any kind of organization understands that fundamentally The ability of the organization to be effective and efficient depends on its organizational structure. It depends on the structure of the organization, and then it depends on the people who occupy different roles and functions in that organization. And so as we begin the process of righting the wrongs at the QEH, we start where any good strategist would start. We start by looking at the organization and how it is led. Because I want to say to you, Mr. Deputy Speaker, that an organization, in spite of how well-meaning the club members, the teachers, the employees, in spite of how well-meaning all of them are, organizations tend not to rise any higher than the level set by the leadership of those organizations. And so that is why it is absolutely essential to have both the correct structure, but beyond the correct structure, the correct people occupying places in those structures. The tone of an organization is set by its leadership. The approach of the organization is set by leadership, and this is in spite of any policy that may be put in place by a board or by a minister. The tone, the effectiveness, all these things reflect the competence of the structure that has been put in place, and then the leadership that has the responsibility for executing on the service delivery or the product delivery that that organization is set up to deliver. And so, because an organization would normally reflect the leadership has to be, the structure has to be carefully put in place, and the leadership has to be carefully chosen. I don't need, Mr. Deputy Speaker, to repeat the qualifications, the experience, the aptitude, the attitude of the description of the person described earlier by the Honourable Member for the City, the Minister of Health and Wellness. I think his description, and I agree very strongly with the Honourable Member for St. Michael South, his description says to me that his eyes are on the real prize, and that the organization is going to be very, very well served in this new dispensation. This dispensation that will arise out of the implementation of the amendments to the Queen Elizabeth Hospital Act, Cat 54, that we are discussing today and this evening. I would want to say, I'm not going to be long, I'm repeating that so that I also remember. The Queen Elizabeth Hospital, and it is an organization that deals with those who are ill. Those who, like the Honourable Member, as described by the Honourable Member for St. Philip North, people who are often fearful and people who are definitely vulnerable. And so the approach of the hospital, of its leadership and its staff and everybody connected with the delivery of health care must be a human-centered approach. And it is interesting that in medicine, we talk about clinicians, while in organizational theory and practice, the clinical approach is not seen as the human-centered approach. But I think we understand the peculiarity of the medical profession. And so I would just want to say to all those connected with healthcare in Barbados, when a person comes in to the accident and emergency department, for example, and I've had to speak to some of my constituents about this. Once you feel bad and you go to A&E, you feel as though, as we were saying in St. Peter, you feel as though you're going to die. So you believe that everybody must drop what they're doing and attend to you. Everybody who goes to A&E not going to die or not close to death. But people who are ill and who are not themselves physicians and who are not sure what is happening with them need to be put in a position where the information is shared, where they're told, well, we have done a preliminary exam, you are not going to die, but this person next to you is probably going to die, so let us deal with this person first. What I'm saying, Mr. Deputy Speaker, is what the Queen Elizabeth Hospital, the current board, is already trying to put into place. And I'm just saying this because I, like the member for St. Michael's South, believe that we may not be doing as good a job as we ought to, and I say we to include myself and maybe us in this honourable chamber, of saying to the public what is actually happening at the hospital to improve healthcare and to improve the delivery of those services to the public. So that an initiative like the 24-hour system was put in place because this government and the board of the hospital believes that it needs to improve delivery of healthcare to Barbadians. Having set up the triage area, I'm not familiar with all the terms, but I have an idea of what it refers to. Having done things like that, says to me, and should say to Barbadians, that the Ministry of Health and Wellness, the minister, the permanent secretary, the other officers, the board of the QEH recognizes certain deficiencies in the delivery of health care and are working to mitigate any challenges to improve the delivery. And I want to commend the Ministry of Health and Wellness. I want to commend the current board of the Queen Elizabeth Hospital for taking those initial steps to improve healthcare delivery in this country. It says to me that they understand that the approach must be a human-centered one that recognizes that you have vulnerable people, fearful people coming in to the facility who are seeking assistance and who believe that their seeking of assistance is of paramount importance. And so once we are serving people, then we must recognize that they are at the center of our work. The comment was made earlier about how we treat to those who are part of our workforce. And as minister responsible for labor, I just want to spend a couple of minutes not saying exactly something that I said a couple of months ago, but to say to leadership, leaders across businesses, leaders across institutions, even leaders in civil society, even at the club level, football club, cricket club, I want to repeat myself. I want to reinforce something that I said earlier. The job of a leader is to build a team to execute a particular mandate. And so a leader has to see him or herself as the facilitator, the builder, and the facilitator of a team. And at the hospital, when we hear of situations where junior doctors are feeling hard done by, I just want to appeal to their superiors to recognize that they are people too. And that if we want the organization to be efficient, if we want it to be effective, if we want the organization to serve the purpose for which it was created, then we have to treat team members as human beings. We have to make them feel a part of the organization. We have to make them feel wanted. We have to let them know, we have to demonstrate that they're being listened to, that their comments are being taken on board, that if we can make any adjustments to the way we do things, do our business, that we will do it. We have to spend some time as leaders focusing on building and facilitating our team members. In that vein, I would want to say to you, Mr. Deputy Speaker, that the Ministry of Labour has worked closely with the Barbados Workers Union and subsequently with the Ministry of Health and Wellness to roll out a national workplace wellness policy, and now a committee to oversee the implementation and the operationalization of that national workplace wellness policy. We have had some good meetings with officers that included officers of the Ministry of Health and Wellness, because wellness finds its home in the Ministry of Health and Wellness. And there's already a national committee for wellness. And my ministry has taken the position, with the blessing of the minister and the leadership of the Ministry of Health and Wellness, that we will, on their behalf, focus our efforts on the workplace, so that the ministry's committee does not have to spread itself too thin to get into every nook and cranny, but the Ministry of Labour, working closely with the Barbados Workers Union, where the idea germinated, and I think they deserve some credit. And the gentleman, I haven't received leave from you, but I'm sure you wouldn't mind me calling Orlando Gabby Scott's name, because it is in such a good context in which I call it. He's been the driver. I mean, he is known to have been the driver for wellness and health and safety for many decades in Barbados. And we got on board and we pushed this initiative along. Now, Mr. Deputy Speaker, the National Workplace Wellness Policy has at its root an understanding that those who work need to understand that they have a responsibility to be well, not just to be free from sickness, but to do things that will engender wellness. Because we realize that if we do not tackle the issue from the perspective of wellness, we will end up having to build 2 or 3 or 4 QEHs. So that we want to focus on wellness in the workplace, even as the ministry focuses on wellness generally in the country. So I just wanted to inform this Honourable Chamber that we are at this point now where we will be moving pretty swiftly to adjust the focus of safety and health committees, which under the Safety and Health at Work Act should be formed and functioning in every workplace, except those in domestic situations. But those safety and health committees, we are working to broaden the scope of those committees to include the matter of wellness. So not just, Mr. Deputy Speaker, looking for trip hazards, mats that should be replaced, or cords that are across walkways, not just looking at windows that have the potential to slam and squeeze people's fingers, but looking at wellness for workers, physical wellness, social, spiritual, all aspects of wellness, psychological, mental, all aspects of wellness we are working toward in terms of getting our workers in a situation where they can consider themselves to be well. I also want to say, and I know this to be true, on behalf of the Ministry of Health and Wellness, that I recognize, even as Minister of Labour, a concerted effort to improve dialogue with workers' representatives. And so I have seen, because I've been present at one of those meetings, dialogue with the unions that represent workers in the healthcare sector. I've seen an openness to hear what the workers' representatives have to say and to respond. As a government, we may not always agree with the position of the workers' representative, but we have, as an administration, determined and committed ourselves to listening to workers' representatives, listening to trade unions, trade union leadership, and responding, either to make adjustments or to indicate why a particular position is not feasible or viable at this point in time, or maybe we don't see it as fitting in to the policy that we want to pursue. But I want to congratulate the Ministry of Health and Wellness for reaching out to trade unions in Barbados. We have not reached perfection, and so there is always room for improvement. So I don't want, Mr. Deputy Speaker, to give the impression that the Ministry of Health and Wellness or any other ministry that we are where we ought to be in relation to that dialogue. But I want to reassure the country that the commitment to that dialogue remains strong. And I can say to you, Mr. Deputy Speaker, that up to Monday at the Social Partnership meeting, the Barbados Registered Nurses Association made a strong intervention at the meeting on behalf of their members. We as a government, the Prime Minister as the chair, and I as the deputy, made a commitment that we would follow through, and we will be working in collaboration with the Ministry of Health and Wellness, follow through those representations. But that, Mr. Deputy Speaker, is just an example of this government's approach to engaging with the representatives of workers for engaging in dialogue with those who represent the interests of workers in this country. We also believe that the ongoing training of healthcare professionals is important. And that is why, as stated by the Minister, the Honourable Member for the City, the matter of training nurses, the matter of ongoing training for other healthcare professionals is one that is top of mind for us. And educational facilities in Barbados have been welcomed with open arms once they are legitimate and once they fit the criteria that we have set. Now, we are not going down the road, Mr. Deputy Speaker, of the previous administration and letting in whosoever will. You must meet certain standards. You must adhere to certain criteria. In other words, we will not be admitting educational institutions who will bring the good name of Barbados into disrepute. We understand where the last government may have gone that route, because the good name of Barbados was already being eroded by them. So it probably didn't make any difference whoever they brought. But this government takes a different approach. And so having the university campus that is located at Wilde and the one located at the Lord Erskine Sandyford Centre is our approach to saying to our people that we will be providing healthcare training, making the facilities available for healthcare training. Now, Mr. Deputy Speaker, I want, before I say, just to say, to face the reality, the Queen Elizabeth Hospital needs help. There are many pieces of equipment that need to be replaced. And I would want to say to the country that the needs of the Queen Elizabeth Hospital are not any secret. So if anybody comes to this chamber to say that they are revealing something out of notes, it is no secret. The Queen Elizabeth Hospital published a prospectus that said to the world, this is what we need. And so the Queen Elizabeth Hospital, and we had a meeting not very long ago, a few weeks ago. The QEH and healthcare in Barbados will be of particular focus for philanthropy in the year 2020 when we celebrate the gathering. We have made a determination that because we recognize the importance of healthcare to our people, the people we've been elected to serve, we will focus very specifically on healthcare and on the healthcare institutions of this country as we ask the diaspora and as we approach friends of Barbados and ask them to make donations to this country, the country that they all love. The Queen Elizabeth Hospital and other healthcare institutions will receive specific focus. We have already started to meet persons from the board of the QEH and the Ministry of Finance and my ministry, which is the ministry responsible for philanthropy, for Vision 2020 regathering. We have already started to meet. We met with the Control of Customs as well, because there are people who will want to send in pieces of equipment. The QEH is working already on, maybe has completed, I'm not even too sure, the prioritizing of the equipment that it needs. And so this government, as it seeks to get the structure of the organization right, is at the same time, because we believe that we can walk and chew gum, even though I don't like chewing gum. But we believe that we can do a number of things simultaneously. So while we work to get the structure right, while we work to get the people right, we are also working to address the equipment needs of the QEH. Barbados, even in the best of times, and I reflect on what the Honourable Member for Christchurch West said, even in the best of times, you will not have every piece of equipment at the standard that you want it to be at. And so we recognize that we can't do this on our own. We are a government of partnership. And so we are reaching out to the diaspora, we are reaching out to friends of Barbados to assist us and to assist the country with providing the equipment that is needed for healthcare. And I want to say to Mr. W.
Member,
Speaker,
you have 2 minutes.
yes, as I wrap up.
But before you sit, before you sit, I like the idea of the philanthropy that you talk about. But it's the most difficult thing because in North America, I get many people have been saying to me, they cannot get through to Barbados, whereas all the equipment have gone to the Caribbean.
Yes.
But we don't get anything. So
right.
You need to tell us how that will happen.
And that is the reason why I indicated that we met with the Ministry of Finance and the Control of Customs. The last meeting we had included the Ministry of Finance and the Control of Customs. We recognize those challenges. They have been, Barbados has been talking about them for many, many years, Barbados and Barbadians, and we recognize that there's an issue. And so the meeting that we have had, and we're going to have further meetings, we've already started to work through. And as a matter of fact, we have designated a person who has started to work on simplifying the process.
Right.
And we believe, and the QEH, and that is why I agree with all those who compliment the current board. The QEH has a person on its board who is focused on this philanthropic effort and who understands the need and who is focused on making it easy for people, especially those in North America and Europe, to be able to contribute. You know, Mr. Deputy Speaker, the last government, in its disorganization, would actually accept equipment that was, in some cases, outdated in terms of the technology. They had no vision, no focus. It seems to me as though they did not care about the people of this country. This government is a different government. And Mr. Speaker, Mr. Deputy Speaker, we are focusing our minds and have focused our minds on delivering excellence in our primary healthcare institution. And so the QEH is in the process of prioritizing that list. The prospectus was already prepared, but the list needs to be prioritized. That is actually happening as we speak, maybe completed by now. That will be put out, and we're going to make it easy for people to assist in building out that facility. I want, as I wrap, Mr. Deputy Speaker, to reaffirm my support for this bill. It says that this government is on the right track. It also says that we have not yet reached our destination, but our intention is clear, our motives are pure, and those who supported us can rely on us to deliver for them and on their behalf. I thank you.
Thank you. Member for Christchurch West Central.
Mr. Deputy Speaker, Reister gave my short, brevity. The theme of brevity will remain with me, but I'm not an neologist like my two previous colleagues and speakers who understand the different meaning of the word brevity. But I will be short today because, Mr. Speaker, this is a simple amendment to a bill, and when I reflect on the importance of this bill, Mr. Speaker, a maxim came to mind, and that is that a healthy nation, Mr. Deputy Speaker, is a wealthy nation. And when you extrapolate that for what it means, I want to say that there's a conflation of the physical being, the social being, the emotional being, and the mental being, Mr. Speaker. And these four things must collide in an effective way so that each and every single Barbadian remains healthy, productive, and can have social and economic benefits to this country. And Mr. Deputy Speaker, another thing that you may be interested in is that the most precious possession for mankind, the most precious, if I visit a next maxim, the most precious possession for mankind is itself. And you as a sexagenarian, you may think that it's another word beginning with P, you call it a red. But the most precious possession for mankind,
is what?
I repeat, is its health.
His health.
Not the other word beginning with P. You would understand what you're talking about, Mr. Deputy Speaker.
Okay.
But, Mr. Deputy Speaker, before we go forward in terms of what's happening in the hospital and to improve our health system, we have to revisit what happened in the last and lame 10 years of existence in Barbados and what pretended to be a healthcare system under the last administration, where there was an abracadabra moment not only in every single ministry, a disappearing of sorts, but in the hospital as well. And the Member of Parliament for Church West reminded me that even a gurney disappeared. It was a magical moment. And you hear about the magic that doctors work in the hospital because they provide human service for the patients there. They work in extreme circumstances. But you had a situation where toilet paper that was ordered never reached and redound to the benefits of the patients. Bandages. And you heard the Honourable Member for Christchurch West talk about gloves that were double in terms of price. All of this nefarious behavior at the Queen Elizabeth Hospital, where any government that is serious about the people and understand that the health, as I said earlier, of the nation creates economic benefit, and that we must have a healthy workforce if we are serious about every single thing, and how we can buffer this country as it relates to climate change, as it relates to ensuring that we have a sustainable development plan. to ensure the survival of Barbados. And if you are serious about sustainable development, if you are serious about bringing a country in line in terms of health care with other countries, you cannot do it unless you are serious about the people. And that is the most important thing. And the people certainly in Civil Hill, and Gore Hill, Sergeants, Vauxhall, and all the other areas in the epicenter of Christchurch, which is called Christchurch West Central, who have allowed me to vocalize on their behalf, even if I catch Glotterfly in here. Even if I catch Glotterfly, I will vocalize on their behalf. I've sent me here with a message, and the message is that I will do everything in my power to protect them and protect their interests, and their health care is a part of their interests.
Right.
And I'm saying that what happens at the hospital affects every single one of us. What happens at the hospital affects every single one of us. The rich, the poor, the fat, the small. Every single body is affected by health and health. And I'm saying, Mr. Deputy Speaker, one thing that money can't buy, although the last administration may want to rebuke this, they may want to debate it, but one thing that money can't buy, and I'm sure one of their members are in somewhere in America saying the same thing, one thing that money can't buy is, Member of Parliament for St. Thomas in Love, she know about that because she at that age, she in the twilight of her years, but it's health. And health affects us in one way or the other at some point in time. And when persons feel that they're hidden under some cloak and they're immune from the variables of ill health, I am saying to them today, well, they will have to have a rude awakening. So what the Minister of Health and Wellness is doing in terms of putting measures in place for proper management of healthcare in Barbados must be applauded. And I am glad today that he have moved with a pace to ensure that there is management and proper management. It's called an executive chair of the hospital. One that will oversee the day-to-day management, obviously utilizing the staff that is there. And I'm saying that we have good staff in the hospital. I worked there when in a previous vocation. I did vacation there. But in the previous vocation,
you worked there?
I worked in hospital in 1998. And I spent a good time in 1998 at the Queen Elizabeth Hospital. And I understand both from a patient, because I was a patient there as well in 2000, from the point of view of a patient and the point of view of a healthcare worker. So I had the experience of both worlds. I understand what it is to be in agony and pain, and your cry is not being answered. But there's only so much that one can do. I understand as a service provider how to work with every sinew of my being to try to alleviate the problems and the health issues that affect the Barbadians. And that is a service. I am saying to you, it is a call to serve. In the same way that the Member of Parliament for St. Peter would say that he have a call to serve in a consecrated way. And the service in the hospital, the call of service in terms of providing health care is one that is invaluable. It's one that you can't put dollars and cents to. And I'm saying, because I have to speak to the nation's youth, those in the dawn of their lives, the impressionable youth. And I am saying to us, if you are serious about this country, we cannot talk health care and wellness unless we talk about our young people. And the fact that our young people must understand and must get certain messages as it relates to healthy lifestyle, to eating correctly, to ensuring that there's an exercise program, and that sedentary lifestyle is not part of the Bajan conversation that we're supposed to be having. And we must ensure that our schools provide a diet that is suitable for our young people. 1 out of every 3 young persons in Barbados, 1 out of 3 suffers from obesity. Mr. Deputy Speaker, between the age of 0 to 25, That's why the United Nations recognizes young persons as. In Barbados, they recognize it as Minister of Youth, and this government certainly, between the age of 15 to 30 years old. And I'm saying to you, Mr. Deputy Speaker, those figures are unacceptable. We cannot be talking about Barbados in the 21st century and beyond, the new millennials, all these fancy terms. And we are having a situation in this country with a small population where 1 out of every 3 young persons, 1 out of every 3, suffers from obesity. And they don't have to remind all and sundry about the chronic non-communicable illnesses affecting our young people. That is why I'm so concerned about that and exercise program. Years ago, and the member of parliament for St. Thomas can recall, she have a good grandmother. And she can recall that in her days of going to school, it may be a little distant, but in her days of going to school, she can recall that an exercise and physical education was a must. In the same way that the member of parliament for St. Peter can recall that prayers on morning was a must, irrespective of whatever denomination. But physical education was a part of the syllabus, and you had to do it. And we had the incidence of obesity and diabetes and high blood pressure and hypercholesterol that we are seeing now in this day and age. Our husband, as a member of parliament for St. Thomas rightfully said. But then look at the schools, not outside the schools, and I'm not condemning any vendors, because vending is something that we believe is part of the conversation and has been a historic part of our conversation in this country. But I'm saying and encouraging them to provide healthy food alternatives for our school children. I am saying to the canteens in the school, let us have a healthy diet for our young people, recognizing that chronic non-communicable diseases are affecting our population and our workforce. Yeah. And these are the concerns that I have as Minister of Youth, certainly. And when I go in the hospital and I see a big vending machine with sweet drink and snacks, it's the biggest oxymoron I come across in the 21st century. A big machine with simple sugars and fatty acids. It is the concoction for disease and illnesses.
Oh my.
The panacea for diseases and illnesses. Okay. And I am saying that I am encouraging the next chair, executive chair, to do something about it. Because you can have healthy snacks and healthy drinks, natural juices in the same machine. It may cost a little bit more, Mr. Deputy Speaker, but the upfront cost may redound for your benefits because you pay more money in health care when you're sick. I understand it, Mr. Deputy Speaker, because I told you it was a patient there. And another thing I'm going to say today, I know that it may raise the angst of it in the air of certain people, but I want in this country those who provide health care for Barbadians. Oftentimes, and the people of Christchurch bisexual ask me to open my vocal cords today and to say on their behalf that too often they're going to the hospital for surgical procedures. I was a patient, I had an eye operation in 2000. Man, I recall that I was on a waiting list. I went there how long? But as a poor Barbadian like anybody else, I was on a waiting list. And believe me, Mr. Deputy Speaker, that waiting list was put in the garbage when I came up with $4,500 to pay for the surgery I got it the next week. And this is the cry of the average Barbadian. And that is why I know with the executive chair that we put here that these sort of anomalies, I call it oddities, won't be happening in this country because it's affecting poor and ordinary Barbadians. Poor and ordinary Barbadians who cannot afford health care like me. Mr. Deputy, and you probably, Mr. Deputy Speaker, I thought about your most precious possession of mankind. You're still laughing. You're a sexagenarian. At the age.
I noticed that you're very attractive to the member for St. Thomas.
Oh, she's in the, they say, Hubert Humphrey is not, I don't know if he's related to our member of parliament for St. Michael South, but Hubert Humphrey said that the moral test of any government is how it treats the elderly. I even make sure I am part of this parliament that passed the moral test.
We know your inclination.
Because they will treat the elderly in a special way. I will speak those in the toilet of their years in a special way. The young Hubert Humphrey. What I am saying is that those in the toilet of their years must be able to enjoy the Barbadian dream.
True.
And they may be able to enjoy health care in this country in such a way that when they go to the hospital, and I thank the Minister of Health and Wellness for introducing the triage system.
Yeah.
A system where that there's an efficiency in accident emergency. Under the last administration, the last limb, whatever you call it, administration, it was an accident waiting to happen in accident emergency. That was what happening. But I'm saying this minister has moved with alacrity to ensure you put a system in place where those that are more serious in terms of the injuries are looked after first. And then you hear him spoke about the 24-hour polyclinic system. Never heard of before in Barbados. You hear about a system that will accommodate persons in a geographical way to access health care. And the people in the congressional constituency of Christchurch by Central, I often refer to it as the epicenter of Christchurch. And I believe it is. Not because that they voted for me, but I thank God they did, because I'm here today to say so on their behalf. And I believe that they are happy and they're thankful for the minister for the 24-hour system. And the level of health care, there's only so much that we can do, but we are saying to you, Mr. Speaker, give us the opportunity. Give us the opportunity to continue to rescue. It's called the 3 R's of politics. We are going to rescue this country. We are going to resuscitate the hospital. Breathe new life and oxygen in to the activities of the hospital. And the fact that the hospital, whether it is in the pediatric department, the surgical department, that there is a systematic improvement in the way how we do business there. And that persons in the hospital must be motivated by good leadership, because that's what we're down to. And that simple basic things that are needed for procedures, that they are available. And there's no manzy-pansy, handsy-pansy business going on in there. And that you don't expect it to drop out in the sky like a Chicken Little episode. Because it wouldn't. It will happen by serious management of an institution. And that's all it's crying out for. And I'm saying that we have a minister, a colonel on the job, who has a military approach to ensure that everything there is in place structurally, so that the ills of the hospital and the malaise that we are seeing could be corrected, whether it is with staff, with patients, with providing the facilities, the equipment. And he has moved in a way, Mr. Speaker, that all of us in Barbados, all in earshot and eyeshot, could be proud of. Remember when we came, I said, remember what you have before any person, irrespective of whoever they are, can go forward. It's like when I go in Buffett's Gap, Mr. Deputy Speaker, and I go to get a haircut, I drive in, but you know something? I have to reverse to get out. So sometimes you have to go back to understand where you were to go forward. The only government that don't understand that R means reverse is the last one, because they believe that R means race and that was moving forward in reverse. It is the politics of oxymorons. And that's what happened last time. They were moving forward in reverse. Because they believed that R, the only person in the world that believed that R means race is the last government. So you know what happened? You can imagine.
So that
I sure Zane Maloney know what R means. Because even the rest, and I want to congratulate him. I want to congratulate him for what he did for the whole of Barbados, and the whole of Barbados is proud of him.
Yeah.
And they want us to congratulate. That's what we should be doing in this country. Look at how persons are inspired under new leadership, because that's what it's about. The good leader leads, the great leader inspires. And I'm saying in the Member of Parliament of St. Michael Northeast, she has inspired not only Barbados, but the entire country and the entire world based on what she has done so far. And everybody talking about traveling. Mr. Deputy Speaker, before we came to office, we have, and the Member of Parliament I see for St. James Central, he's laughing because he was just acclaimed the Minister for tourism. He got an award for inclusivity. These are awards, these are invincible awards, Mr. Deputy Speaker. This is hard work that caused them. And I am saying, when you hear our Prime Minister, the Member of Parliament for St. Michael Northeast, and I'm saying that when you hear about inspired leadership, because you have to inspire. The good leader leads, but the great leader inspires. You have to inspire an entire country. We were at the bottom of the chasm, the precipice of despair, man. There was nothing going on in this country that encouraged Barbadians. And now you can hear that we have moved our GDP, the percentage. It was at 165, and now it's about down at 125 or so. That the GDP percentage down to 125% also now, man. You heard the Minister, the Member of Parliament for St. Michael South Central spoke of the trust that we are having as it relates to reducing the ease of doing business. We see what's happening in the airport and the seaport, where people are encouraged and enthused to come here to do business. And I'm saying to the Minister, he's on the right track as it relates to the hospital or secondary health care facility. And when they say on the right track, and I'm asking him that when you let to improve that facility, I want a unit especially for palliative care, homeopathic care. I know you're doing your best with what you came and found as a rehabilitative unit, where those persons that practice in that area, physiotherapy and things, that a small unit. But I know that this minister has the interests of this country at heart, and he's going to do every single thing in his power. He's going to move every military connective tissue in his body to ensure that Barbadians can get the level of health care that is so richly and deserved. And I'm saying, and it's under the astute leadership of our Prime Minister. And when persons talk about traveling and all sort of things, we came to government with Barbados having about 25, they help me, Member Parliament for St. James Central, about 25 different trip advisories. One trip advisory, next trip advisory, that has sewage on the coast. When you talk about health, that was a trip to person, health, visitors, everything. They had trip advisory after trip advisory, the only thing to do is trip up Barbados. Now we are talking about serious issues of health care.
Member has 2 minutes more.
Oh, man. I said I was going to be brief, but I will have to have a different meaning of that word now. I will have to become a logo for like you. But these are the things that we were faced with. We understand, Mr. Deputy Speaker, that the health of a nation is one of the most important causes in the development of any country in any part of the world. And I'm saying that every single member of this party, this old man of a party, or old woman of a party, whatever you want to call it, I may call it old woman, because that may resonate with me more.
Yeah, we know.
But this old man is a septuagenarian party. This party.
We know that's not finished before that.
This party since 2018, Mr. Deputy Speaker, since 2018, the 24th when the people of Barbados resoundingly give us the mandate, we have moved with every collective sinew of our body in every single ministry. I don't mind the naysayers, fearmongers, and the ones that keep the mesospheric noises. That don't have what the focus that don't help about the focus of this government as it relates to building this country, as it relates to ensuring that we restore normalcy in the land, and that we are able to re-energize Barbadians to be the best that there can be. And the health service is an important and integral part of building up any country. And I say, Mr. Deputy Speaker, we have made a step in the right direction, because you know, as I do, that the journey of 1,000 miles begins with one first step. And I want to thank and applaud the minister today. Thank you.
Thank you. Member for St. Thomas. St. Thomas. Oh, wait. You want to give it? All right. St. Thomas.
Thank you, Mr. Speaker. The honourable member in her youthfulness recognizes that the aged should be respected. I want to thank her sincerely, Mr. Speaker, sir. That's not what you call making you know your place, but she's given me the opportunity. I'm grateful. I shall try to be brief, because I felt it would be remiss of me if I had not, in this honourable chamber, seek to first give my support to this resolution that the honourable member for the city and the Minister of Health and Wellness has introduced. But I also felt it is my duty, having the remit to look after the poor and the aged, to make some comments. And I believe that in this equation, the aged and the poor are the ones who suffer most. But I want to, at the outset, say, Mr. Speaker, Mr. Deputy Speaker, that the government of any country should be of the people, by the people, and for the people. And this Barbados Labour Party administration is determined to ensure that all those distinguished men and women, young people who came out in their numbers and gave us that trust that was required for us to become the government of the day by giving us all 30 seats, that I believe that their needs and interests should be on the front burner at every time. And so this government is making every effort to ensure that the people of Barbados receive the quality care and safety that is required for them to be able to enjoy life a little longer. Now, we all are aware that the free education and health care that has been extended to us for many decades has caused our people to live longer and healthier. But according to the Honourable Minister who just took his seat, many of us have lifestyles that will impact on the quality life that we should enjoy in our senior years. And therefore, we understand how difficult it is for the hospital, the Queen Elizabeth Hospital, to be so heavily impacted upon at this time, especially with the chronic non-communicable diseases that are tearing away at every household. And the extension to that now, sir, is Alzheimer's, or dementia, or senility. As we know, all of those expressions kind of tie into the same. And I want to say that it is a very hard life for the poor and the disabled and the aged, because they're the ones who meet it the hardest. And most hurtful is the fact that many of them have no families to help to look after them, to ensure that they receive that quality care that should be extended. Now, I want to laud the efforts of this Honourable Minister, because for years we were hearing about opening in polyclinics for a longer period. And I'm happy to know that the numbers at the Accident and Emergency Department have been diminished to a point, because many are now going to the Winston Scott. And I pray that the one at the St. John Polyclinic, the David Thompson Polyclinic, will soon be opened as well, so that people in the eastern part of and the central part of Barbados can go there for the 24-hour treatment and minimize the numbers that are swelling in the Accident and Emergency Department. Now, Mr. Deputy Speaker, for so many decades, Barbados has been in the vanguard for training not only nurses for export, but training police officers, where our regional police training school had persons from Montstratton down the OECS and so, our teaching system, the Urdistan Teachers Training College, accommodated teachers from across the entire Caribbean because of the high quality training that would have been extended to make them the professionals that they eventually turned out to be. As a matter of fact, sir, I came into the teaching system when we had that terrible brain drain of teachers going to Cayman, the Bahamas, to London or England, the United States, and different countries. And when we were so depleted in the late 1969 and 1970, that is when teachers were even drafted into the system with one certificate to be able to improve themselves. And I agree with what the Honourable Minister said. We need to look at some kind of pre-training to help our nurses. Before we entered Urdistan, we had to do a pre-Urdistan course where we looked at the rudiments of teaching and how to be professional teachers and the kinds of aspects of psychology and so on that we should know in order to be able to interact with the children. And I became extremely saddened, sir, when I learned that those 60 nurses that were supposed to be trained every year through the community college and of course the Ministry of Health and the hospital, that project seemed to have come to a halt. And I know that there are thousands of Barbadians, males and females, who want to become nurses, who want to become doctors. But unfortunately, those avenues were closed towards them getting the kind of help, and they had to divert their interests into other avenues for employment. And so I am happy that the Honourable Minister was able to make the negotiations with the Ghanaian nurses. We know that we had other nurses from Africa before. We had nurses from the Philippines who worked here. And it was so sad that one of the ministers used some very derogatory remarks to talk about why the ones from Africa had to go back home. They were extremely badly treated. But they were the ones who had expertise at different levels that were training our own Barbadian nurses to become that professional. And they were unceremoniously sent home by that last administration. And it hurt the system a lot because they were being learning the skills on the job instead of always being in a classroom, which is also very, very important. So we always train people for the export market, and nowadays it seems as though we're going to have to do some kind of special psychology or something with our young people, because almost all of them want to remain at home to work. Barbados got remittances from the nurses, the doctors, the police officers, the bus drivers, and so on, and that is what helped to build the economy of Barbados. Our young people have got to learn to explore and go across the world, and they can go into all these frontiers and these avenues that will help to empower them. I have a grandson who is now 21, Mr. Deputy Speaker, sir, who determined I do not care, Granny, how many certificates I have through CAPE or whatever. I do not want to be any lawyer. I don't want to be any doctor. Granny, I want to be a chef. And he just qualified in Canada to be a chef and is not interested in coming back home. A lot of opportunities out there, especially in the same Canada. But some of our young people don't want to go because they want to stay at home along with granny and grandmother and mommy and so on and muchi. We need to get our young people properly guided through the career opportunities that are offered through the guidance counselors and others to make them aware that teaching is a vocation par excellence. Nursing and other aspects of that kind of social training will help to make a tremendous difference. And staying at home, yes, will help, but there are times when the system gets clogged. And therefore, but we now have that big challenge of a shortage of nurses, and I believe that we need to do more, and the Honourable Minister put us on the track, that training that would have taken place in the Caribbean that would have been causing so many challenges, they are now putting remedial aspects in place to be able to make the difference. Now I also want to say, sir, that the workers at the hospital are human beings too. And we must never lose sight of that. Burnout is one of the worst things could ever happen. I believe politicians will get burnt out too. especially our crop, because we are working 24 hours in the interest of making Barbados right, having gone through so many challenges in the last administration and the neglect in almost every sphere of government that has caused our people to be now suffering in a way that is different from any other time in the world. And the history of Barbados, I should say. And so the heavy burdens on the staff and the lack of resources, and of course, yes, the birth program was instituted, but I am not aware of any nurses who were sent home. And I believe that those who are working should be paid in a more timely fashion, and we have seen how efforts have been made to make sure that they have been paid, and the other workers in the hospital and other institutions associated with health have to be paid, because if they don't get paid, they cannot give of their best. They have their families and their commitments and so on to rely on. I had the reason to go to the Queen Elizabeth Hospital for surgery in the past. My appendix burst just before Christmas one year. And I had the best treatment ever. And I will never want to go to any Miami or anywhere in the world, because I know that the skills and the quality service that will be offered at the Queen Elizabeth Hospital, because I witnessed it myself. My challenges, however, are what has happened, are associated with what is happening in the accident and emergency department, where sometimes people are there sitting for hours, and they know that those the times of waiting were reduced when the government first changed. But now we are seeing every day somebody stabs somebody, somebody shoots somebody, and every time or some serious accident somewhere. There was one with a minibus this evening that hurt my heart, because it's a lot of careless, not defensive now, but offensive driving. And whenever you look at it, what does it do? It causes those who are injured or those who are impacted upon in whatever way, whether it's a traumatic kind of attack, a panic attack, whatever, to be right there at that hospital. And those are the critical matters that nurses and doctors have got to attend to. For those of us now who go with the foot for dressing, or for some little pain in the hand or whatever, those who are waiting in that AD have to be on the back burner in order for these critical aspects of what has occurred with the shooting and the bleeding and the stabbing, and so they have to be attended to. What hurts me more, I love human life, sir, but when persons don't even think of the repercussions of the nonsense they are doing and impacting on others, and sometimes those who are injured are innocent bystanders. And therefore you can't say, well, leave out them, they're criminals, whatever. And we have to treat for human life in every sphere, whether it is wrong or right. Saving lives is an important aspect of it. So the staff there, when I saw them 3 weeks ago, when I went with a friend who has prostate cancer, I spent quite some hours there. I saw the burnout in those young doctors and nurses. I saw the burnout in the orderlies. I saw the burnout even in the maid, who had to be cleaning consistently because the numbers in the A&E were so large. A lot of that is as a result of people living longer, other diseases that are kicking in, and not having the funds to be able to get the kind of treatment that they need with private doctors at times. The money is not always even there for me. Furthermore, persons who are vulnerable or who are aged or who don't have family. And to compound what is happening at the hospital, and that's why I so highly respect the doctors, the nurses, the cooks, the cleaners. I respect everybody, because I know most of them, if not all, work beyond human call to make that institution called the Queen Elizabeth Hospital service the people of Barbados. But my hurt is families are so disjointed now that senior citizens go there, families take them. And I'm not talking about families where only one person may be working and they can't stay at home with the little old lady or little granny or the little mommy or whoever, or granddad. But some of them just bring the clients and leave them there. And the costs to keep them there per day is prohibitive. And then they occupy beds and other areas in the hospital where critical care patients should be occupying, and they are left there. Yes, I understand what is happening. I see it every day. I get letters every day. I get messages every day. My granny is ill, my mother, my father, my uncle, and so on. And we need to get them put in an institution. And I want to say that we are talking about philanthropy, And it would be a useful thing if we can have more dialogue with those in the diaspora, if you're talking Vision 2020, and those persons coming here, to let them actually see and see how best we can assist in helping to build more institutions to cater to the needy, to cater to the disabled, to cater to the aged. So you're talking daycare centers that will be run by private institutions and take some of the load of the hospital that should really be there for real critical patient care. And so because we're living longer and we're experiencing the challenges, it still is important that we get the necessary persons in place and minimize what is happening with all the traumatic experiences at the hospital. I know, and one of the honourable members mentioned earlier, that from the time, I think it's the honourable member for St. Philip North, who talked about from the time the seniors and others here, they say not me in the hospital. And that is because of sometimes what people say when they did not have the experiences. Because my experience was a good one. And it was not because of who I am, because I was not here at this level at the time when I had the surgery. And when I took my father, that was not the same thing. When I took my friend 3 weeks ago, there were challenges because of the large numbers. You can hardly walk the corridors. And therefore, I think it is important that all of us come and pull together to see how best we can work with the management of the hospital to be able to mitigate some of the challenges we are experiencing. But I want to also say, Mr. Deputy Speaker, sir, families have got to come on board and help. Unless our families come on board, it is going to create even bigger problems, especially with the aged and how they have to be there, sometimes 20 and 30 of them, occupying good critical beds that should be there for the real sick people. I also want to say that there was a project that the Cuban government worked on eye surgery, and hundreds of people spoke about their experiences. That is now finished. I have a gentleman who called me Mr. Deputy Speaker 33 times over the last 2 days. He has to have surgery. He suffers glaucoma, diabetes, glaucoma, and so. And he's being put to have an appointment another 8 to 10 months from now. And every morning, the eye seems to have this white cast coming over it, according to what he is saying, because he does not have the funds to be able to pay for it. Those are the ones for me that need real quick attention, and I don't know what was the reason why the Cuban project was closed off, but I believe that we should venture out to see how best we can get other countries helping us where they have the expertise, because to lose one sight is a very unfortunate experience. And he is only one. There's so many others. But what hurts me most of all, I have a sister who went to the hospital. She's a sister by father, but she's still my sister. About 3 months ago, and she waited an entire day in the outpatients department. And whenever you ask, the doctor is not coming yet, or he's not, and then when you wait 5 and 6 hours, you hear he's not coming today. The doctor she learned who the doctor was. My niece made a phone call the next day, and the same doctor who could not come to treat the poor people in the Queen Elizabeth Hospital that sent them through our blood, sweat, and tears, working in agriculture and on the buses and in the roads and so on for the free education to get the training, the doctor told her, if you bring her next week, it will only cost you about $5,000 so that your mother can get the surgery. And she quickly went and did it. So we are doing that, and we are fleecing their pockets, we are filling their pockets. But it is unfair to the people of Barbados if the persons are there assigned, even if they come and treat to 2 or 3 per day. But don't come at all, and people sit and they're starving and cannot get the treatment. Those are some of the challenges. Management has got to deal with those matters as urgently as possible, because too many poor people, too many old people, too many sick people are suffering because of their circumstance. And I came from the bowels of poverty, and many of us here perhaps are, even if you don't want to tell the public, and I have a difficulty in understanding why poor people must be put on the back burner when so many millions of dollars of our foreparents who lived to build the economy, to be able to make sure that those systems are put in place, those benefits are not trickling back down to the poor in the way that we expected. And I'm not an advocate for the poor now because of where I am. I have always been an advocate of the poor and the downtrodden because somebody has to have a voice to speak for them. This government is going to make sure that the message, that the strategies and that the necessary changes put in place will help to lift the status of the Queen Elizabeth Hospital again, where we know from people from all across the Eastern Caribbean came here to this island to get treatment and left feeling proud of the services that were extended to them in the past. We have to get it right again. So I'm saying, Mr. Deputy Speaker, the long wait for surgery should go. Nobody should have fibroids, and because they don't have a $3,000, have the fibroids affecting them. Only if you have the fibroids in you, you can know what the feeling is like and the discomfort, the pain. And therefore, those are some of the ones that are pushed on the back burner. And people, because they don't have the wherewithal, they can't do it. So I want to speak to accountability. If we are going to be serving our country, if we say these fields and hills beyond recall are now our very own, if we say we have pride and in an industry and whatever we say, whatever we do, if we see our professions as vocations and not vocations, then we will come with a conscience, and a God-given one at that, to be able to see these are all poor men, women, children who are suffering in front of us every day, and some of us get up and go down the islands and leave patients that are diabetic starving, like my brother-in-law, to treat the patients down the islands and forget that you have people in hospital who are diabetic, that you starve a whole day and don't come back. Something is wrong with the psyche of some of our people, but we must make sure that whatever systems are put in place by the Honourable Minister and his team will meet the needs of Barbadians and those who are among us, because if we are into tourism, it says we have to cater to the tourists who are among us, who may fall ill for whatever reason, God forbid. So I want to say, Mr. Speaker, sir, the other thing that bothers me most, and I want for us to start looking at it, is to cut out pilferage in our institutions. Pilferage is one of the other things that's causing the government, whether it be this one or another one, millions of dollars. I had seen with my two eyes, Mr. Deputy Speaker, about 4 years ago, a truck go into the Queen Elizabeth Hospital yard. Say whatever the number was, because I wrote it down. I do the same thing for the ZRs and think, do I have one here to give the minister when I finish depositing people on a pedestrian crossing? And that truck came in and took up about 10 big brown boxes marked Baxter and left the hospital. It was on an MP vehicle. Where were those gloves going? I saw it with my two eyes. The Lord is my judge. There was nobody in the last government I could even speak to, because they might have known where they were going or known about them. I don't know. God forbid if they knew and they'd allowed it to happen. And I'm saying we need to make sure the element of accountability, as well as the pilferage that's going on in most of our institutions, comes to a halt, because that is how millions of dollars are being given away or are being used, and not to the benefit of those who matter. I want quality service to be in the forefront. Because I can't give you the treatment necessary today, you don't have to shout at me when I ask, or when there's a diagnosis and I say, nurse, doc, whoever, consultant, whoever it is, I don't even know. Well, what is the problem? You go away. Take it there, reader. Take him a reader. Go down there and make an appointment. That is some of the treatment that we mete out to others as though we are slaves still. The quality treatment must be meted out. My mother, may the Lord rest her, she would have been 100 years, February next year, always said, speech is due to a dog. Respect is due to everybody. And unless we get back that into our culture, Mr. Deputy Speaker, we are spinning top in mud. And I would become uncomfortable if somebody shouts at me. because I have a bigger voice than most of them, and I will shout back and let them know, and I can walk away because I may be able to pay for my services elsewhere. But look how many thousands of Barbadians, honest, hard-working Barbadians who would have given their life to this country, would not be able to do it because of their financial circumstances. And so I want to say, Mr. Deputy Speaker, that I hope that the changes that the Honourable Minister is looking to improve, the adjustments that are going to be made, the appointment for a person or persons to be able to take the Queen Elizabeth Hospital and its management to another level, the plans for expansion to go over to the Enmore Centre and that general area so that services can be extended to the public of Barbados. It is all in the same similar environs because not everybody is financially strong. And when we are looking, Mr. Deputy Speaker, identifying 500 more most vulnerable families at this time. 500 families, some of them may have 2 and 3 people in them, but most of those vulnerable families have 8 and 10 and 15 members living in those households, and they're adding on a little shanty, and they're getting children, they're cohabiting. And therefore, where will they get money from when the welfare department is exhausted now, trying to reach them? And we have a duty, we have committed ourselves as a government, we conform with our manifesto pledges. We are here for the people because we were brought here by the people, and we will stick to the people to ensure the quality services are extended to them at whichever level they are at.
Remember, you have 2 minutes.
Yes, Mr. Deputy Speaker, I want to thank you, and I pray that all those nurses, the doctors, the members of staff of the Queen Elizabeth Hospital and our other health institutions get the opportunity to be able to offer their services in their professional way, but mete out the treatment to the ordinary folk in the same way they will to their friends and their family, because today is the poor man's day. Tomorrow is the next person's own. We never can tell where we will go, so let us treat people as the human beings and give us the dignity that we deserve. And I pray that the staff that is overwhelmed will get some measure of ease. I pray that those who have gone into retirement, that the Honourable Minister may want to draw on the expertise and the knowledge and skills that they have to help them with the preparation of the nurses for the various examinations and the studies that they have to pursue, because there's no point in expending so many millions of dollars in training staff, and then we have seniors who are at home only waiting to be called upon to be able to come back, and many of them do not want money. They want to be able to come back because they believe in giving service to country. And so, Mr. Deputy Speaker, I want to thank you sincerely and to really congratulate the Honourable Minister for his willingness to wrestle whatever the challenges are to the ground, because sometimes we know of the challenges, but we believe we will trigger something, we will hurt somebody's, impact on somebody else's. We have to be strong if we are leaders and make sure that we keep the focus, because at the end of the day, we are accountable to the people of Barbados. And if we say we love human beings, we love God, whom we cannot see, how can we say we love God whom we cannot see, but hate our brothers and sisters whom we can see? We need to treat everybody with the dignity, the respect, the honesty, give them the advice that is necessary. It's not always the best if it is a sad experience, but make sure that we treat everybody with respect. None of us knows whose hands we will fall in as we continue on this journey of living. And therefore, I highly commend the Minister and the team at the hospital that have been working assiduously to deliver the quality care to the people of this country and the visitors among us. And I pray that we'll be able to get resolution to some of the challenges as we go forward, building a better Barbados and leaving no one behind. I wish to thank you, Mr. Deputy.
I'm obliged. Member for St. Michael South Central.
Thank you, Mr. Deputy Speaker. I, for sure, will be brief.
You sure?
On this occasion. I rise to support the bill that is before this House. and in particular to respond to some of the issues that have been raised. The question was raised earlier about the financial capacity of the Queen Elizabeth Hospital, and in particular, a question was asked about the measures that were introduced in this House during the estimates process to be able to offset some of the necessary expenditures of the Queen Elizabeth Hospital. Now, perhaps if we are guilty of anything, it is about not flagging the successes where they occur, because the health service levy that was then introduced is in fact performing exactly as, and perhaps surpassing, what we expected to happen. And I'm looking right now at the recent numbers from the last Joint Economic Group update, where we sit as an economic group, as a government, and look at how the economy and the country are performing. With this, Barbados Labour Party administration does that. Because we know that we are accountable to the people who put us here, and this is something that we have to make sure that we do. So that the target for the health service levy for April to September was $25 million, and that it actually performed at 25.3, so that it actually surpassed what the target was for the period. And so we know that the measure as introduced is performing as anticipated, and that this has helped the Queen Elizabeth Hospital in terms of its cash flow and in terms of being able to meet some of the recurrent and daily and ongoing expenditures that are required. But as it relates to the capital side of things, we know that what is required in terms of capital investment for the Queen Elizabeth Hospital to function at optimum conditions is beyond what it currently has. I don't think that is a secret. But I think further that the Queen Elizabeth Hospital has, and I think will, under the new management that is proposed under this bill, has to really be able to answer the question and to fill the financing gap in a real way. Now, there are perhaps no other sectors other than health and education that attract the level of philanthropic interest and social investment. The health sector and the education sector have always attracted the interest and the commitment of global foundations such as the Bill and Melinda Gates Foundation. There are many entities worldwide that have identified health, the provision of health services to cover both general and specific targeted populations as causes in which they are willing to invest their resources. And I think we acknowledge that the Queen Elizabeth Hospital, and I think the current board also acknowledges, that the question of mobilizing resources for the kinds of capital investments that are required for equipment, for expansion or upgrading of infrastructure, these are things that it is possible to have financed in non-traditional ways. Certainly, whereas Barbados has always been seen in terms of how we are presented in the Human Development Index of the UN, and in several other indices, we have always been seen as delivering well, understanding the delivery of basic social services for the population. But I would encourage the Queen Elizabeth Hospital and those who are tasked with resourcing it to start to look, and I would give the commitment of the Ministry of Economic Affairs and Investment to start to look at new financing models for healthcare in this country. Because the old models are not going to work, and I know that the ministry is looking at these questions, looking at what is the level and what are the modalities for sustainable financing that are going to address these questions, but it cannot and it will not be business as usual in terms of being able to finance the capital expenditure side of things. We have to look at how we are able to make the case internationally for the issues that are affecting Barbadians. We've been talking about questions of vulnerability, about what are these particular issues of vulnerability as they relate to climate, as they relate to environment, as they relate to the economy. We have to similarly look at what are the particular issues of vulnerability, given that Barbados imports so much of its food basket. And a big part of those imports are, quite frankly, things that we or nobody else should even be eating. It is a particular part of our vulnerability as a small price-taking state that makes us so susceptible and to suffer so much from those chronic non-communicable diseases. You cannot separate the economic position and the fact that we have a trade imbalance such that we are importing the majority of our food, and unfortunately, the fact that we're importing so much of our food puts us then in a position of being vulnerable, being susceptible, being open to the kinds of disease that come along with the patterns of consumption that entails. And so this has to be the next frontier of how we look at health financing and making sure that we are able to make the case to mobilize resources outside of the traditional ways that we have always looked for it to come from the consolidated fund. We started with the health service levy. It is performing. We have to push it a little bit further. But I also challenge us to understand that the provision of health care in this country can no longer be seen as being focused and localized only in the Queen Elizabeth Hospital. The Queen Elizabeth Hospital, the footprint alone, the size alone, can tell you that it cannot respond adequately to the healthcare needs of this entire population that are so nuanced and so varied and are changing every day. So what is the solution? It is that the entire area, the entire Bridgetown area, the entire Greater Belleville area, where we know that we have already so many private providers of healthcare, and the other areas, the other hospitals in other parts of the country, that area has to be seen really as the health campus for providing health services in Barbados. And so we have to look at the provision of health care as a partnership, a real partnership, a mutually beneficial partnership that is not skewed towards maximizing profit, but that is part of a compact, a social compact for the delivery of health services to every Barbadian. We have to step away from this notion that the Queen Elizabeth Hospital can be all things to all people. We have to broaden our understanding and our approach to how we are partnering with the other institutions, the other healthcare facilities that exist to be able to provide that care. It means that there's a role for investment to play, and it means that as the Honourable Member for the City of Bridgetown, the Minister of Health and Wellness, has already been engaged in and is already aware, there is a significant level of interest in health sector investment. Why? Because what we frame as the tourism product for Barbados, the sun, sea, and sand model, can no longer be all that we present. So we're not looking at the traditional notion of tourism. We're looking more broadly at the idea of the visitor economy. And I've heard the Honourable Minister of Tourism and International Transport say this many times, that we are looking at how education services will increase arrivals to the country. And as he has said, as the Honourable Prime Minister has said, a student who is staying here to attend Ross University or to attend another offshore university or to attend the University of the West Indies is a 9 or 10-month tourist. Is somebody who is coming and generating and participating in economic activity in other ways. So that the fact that there's so much interest in building oncology centers, in building hospitals that look at specialist care in orthopedics and orthopedic surgery, and in other specialist areas of medicine, means that not only does it have the capacity to earn foreign exchange, to create jobs for Barbadians, but it also has the capacity to raise the standard and the delivery of health service, of health care, for all Barbadians. Mr. Deputy Speaker, it has to be a partnership, because a single hospital in Martindale's Road, as much as we know that it has to be well-resourced, cannot do it all for Barbados. And that is why, in our discussions with developers, with investors who are interested, one of the first conversations we have is to say, we want you to be able to offer your services internationally and regionally, and we want people to come and to get care here and to convalesce here. We want that to happen. But we also need for you to deliver your services in an affordable way to certain segments of the population.
Yeah, that's important.
It is important.
Yes.
We had a similar conversation with potential investors who were looking at setting up a dental school. And one of the things I always recall, my mother used to take us to, at the time it was Lady Mead, now Sir Winston Scott Polyclinic. And that is where we access dental care. One of the things that people who come to Barbados often ask and talk about, especially those who might be coming from the UK and parts of Europe, is, well, you know, how come children and young adults, you know, their dental care is so, it seems as if there's so much attention to it. And it is really because there was an investment made at the time in making sure that children under a certain age were able to access this service at a quality level. I still remember the dentist and the dental hygienist that me and my two sisters saw often at Lady Mead Polyclinic. Now, we know that there are challenges with the provision of dental services in Barbados. And one of the things we said to those developers who were interested in bringing the school and the clinic here is, listen, of course we want you to participate in economic activity in Barbados, but we also need for you to help us solve the problem of making sure that there are enough dentists for school-age children to see in this country. the provision of health care in Barbados has to be a partnership. An investment is not just about helping to create profits for others. Investment for this Barbados Labour Party administration is a vehicle for economic enfranchisement and opportunity for all Barbadians. It is no good to us if it only enriches a few. It is no good to us to say that we have this or that amount of investment if we do not use it as the entry point to be able to bring all Barbadians along. And so we have to understand, one, that the model for health financing has to change. Two, that the approach has to be about a partnership for providing health services, and so that we see the area in which the Queen Elizabeth Hospital is situated as a health campus for the country, but also that we need to get smart about how we are investing, how we are making expenditures in the sector. One of the things that we learned during the estimates process when we looked at the Ministry of Health and Wellness is that we have this challenge, and the member for St. Thomas raised it in her intervention, where people are taking their elderly relatives to the Queen Elizabeth Hospital, and because they don't have, they're at their wits' end, they don't necessarily know how else to care for them, are leaving them there for extended periods. Now, it means then that those beds that are being occupied at the rate of $25,000 per person per bed per year as the cost, compared to $5,500 in the geriatric hospital, and even less if we are able to really find the solution to providing long-term care for the elderly. It means that there are extremely high opportunity costs for that particular problem. It means then that when people are triaged in the QE8 system and then need to be allocated a bed, that they don't have one, because some poor family who don't feel as if they have any options for care for their grandmother or grandfather or an elderly relative has left the relative there at the QEH to convalesce indefinitely. It is a problem in several ways. It is a problem because that person does not receive the holistic care and attention and company and support and quality of life that they deserve. But it is also a problem because the cost of delivering to that bed in the QEH is much, much higher, over 4 times as much of the cost of delivering to that bed, to that patient in that bed, say in the geriatric hospital or in another institution. So it means that, again, we have to get creative and innovative about how we are making use of the productive capacity of Barbadians, people who are interested in care for the elderly. I know that I've talked to many constituents who have said they've gone and done the course, but they don't have any opportunity. How do we create a system, perhaps community-based, where skilled, trained, qualified people, we have them here, are able to deliver that care in a way that still allows the QEH and any partner institutions to deliver care in a cost-effective way?
While I like your argument, I also feel that you need to look at investment for the elderly. How do you find that? Do you have any investment for the elderly?
Mr. Deputy Speaker, I would be happy to get to that in a future intervention. And in the meantime, we can have a conversation about it. But you intervene at the right moment, because I said it would be short. This may perhaps be my shortest intervention in this House. But I simply wanted to offer these observations, some suggestions, some information on really how the investment approach and how the social compact approach to the delivery of healthcare can help contribute to this conversation. With that said, Mr. Deputy Speaker, I wholly support the recommendations being made in this bill, and I am obliged to you.
Thank you. Honourable Prime Minister.
Thank you very much, Mr. Deputy Speaker. I know the hour is late. I shall not say whether I'm going to be short or long, because based on the commentary of those who went before, there's obviously a blighting when you say you're going to be short. I want to enter this debate to say that this is but one step in a long and arduous process to reclaim our healthcare system. And Mr. Deputy Speaker, I am amazed at the extent to which our healthcare system was neglected over the course, in particular, of the last decade. The last time the hospital would have been able to look at serious equipment, to the best of my knowledge, would have been a process that was started in 2007 and finished in either 2008 or 2009 with a bond from the National Insurance Scheme. When I look at what yeoman service is being performed by the staff of the hospital with respect to the equipment which they have and the extent to which they're being hobbled by the lack of that equipment, it is but another example of what we are confronting in the transport sector, in the sanitation sector, in the school system. I can go on at the airport, at the seaport. And with all the best will in the world, we have to play the hand that we received. But this government will not be daunted by the legacy that has been left by the last lost decade and by the government that preceded us, who thought that it was more important to spend money on buildings rather than dealing with fundamental issues that keep and would keep this society together. There are too many people who, as a result of their not being able to earn properly, or the jobs which they lost over the last few years, would have been put at the front line of pauperization. I say to you, sir, that we are conscious that at the hospital, what needs to be rebuilt is almost every aspect of its operations and functioning, from people to equipment, to infrastructure, to systems, to legislative framework. And you know, sir, it's not going to happen overnight, but this government will not be daunted by it. And equally, we accept that we have to be accountable to the public of Barbados for the stewardship that we will have with respect to this institution. Now, over the course of the better part of this calendar year, the hospital has not had the benefit of full management, and for reasons at law that go beyond the capacity of the board to resolve it. So, the last time, I believe, that the members of the board and the administration at the hospital would have seen the last CEO would have been when he sat right here in the well of this chamber, facing questions from members of this honourable parliament. And from the day after, he was on sick leave until just the other day when a settlement was reached for his separation from the hospital. A full 6 months or more. Other senior staff inexplicably resigning and retiring suddenly. Now, I don't know why. And I hope the minister in the fullness of time will share with the country the evidential basis that would have led to sudden resignations or retirements in key senior management positions in the management team. Now, I believe that this is only step one. And I am one of those, sir, who even in our meetings with the medical profession and the nursing profession have said that I hope that we can bring about greater transparency in the operations of the hospital and its accountability. As a result, I'm aware that the QEH board, as well with the support of the Ministry of Health and the minister, have agreed to undertake a study that has started that will see us costing out every single service and the supply of every single material in the hospital. Because I truly believe that the reliance on a lump sum subvention that is not anchored to performance with respect to what we are delivering makes it more difficult for us to measure efficiency and to manage the place in the most effective and efficient of ways. Now, this doesn't fall on the back of any individual, but it falls on the back of a government that says that we need better systems that are more accurate and more capable of independent measurement, so that when we agree to provide X amount of funds, we know how many people will benefit. On that same day that I spoke about when the last CEO was in here, I asked a few questions in that debate, and without reflecting on matters in this parliament, perhaps I need to think of the kinds of things that my head would have been consumed on in March of this year, without referring to my specific debate, because I would not want to breach the rules of this honourable chamber. But in March of this year, my mind was consumed with whether we would be able to see a marked improvement in the delivery of our services for cardiology in this country, and whether we could increase the rates of survival for persons having heart attacks in Barbados. I said then that as Minister of Finance, so long as I can receive projects that are quantifiable, both in terms of expenditure and in terms of meaningful results, that the government would support it. And I did it in that way to begin to send the message that we have to be accountable for the things that we say we will do, not only in terms of expenditure, but in terms of the outcomes which will flow therefrom. And I look forward, I'm told that the hospital board has now been able to look at how it will put arrangements in place institutionally for us to be able to see progress, not just in fact on that cardiology project, but on other projects, 2 or 3 other projects that are absolutely critical to our being able to bring greater quality of service to the Barbadian population as we found them. Sir, our determination to be able to open a 24-hour polyclinic, to be able to take some of the pressure off of accident and emergency, is another such identifiable project. And I am anxious, and the minister knows that I am very, very anxious to receive the proposals for the renovations of the accident and emergency section, because I feel strongly that that section is in need of serious rehabilitation and reform if we are to meet the needs of a modern Barbados as a major hospital that is treating to emergency care. It is unacceptable for anybody to have to endure pain because they do not have money to go to a private facility. And as long as this government is in office, the provision of health care to our citizens will remain an absolute priority for this government. Similarly, sir, we understand that there's an acute shortage of personnel, in particular nursing care. And to that extent, we did a number of things. The front page story of today's paper may speak about future appointments, but what it doesn't necessarily say sufficiently is that due to the intervention of the Minister of Health 6 months ago, that in meeting in my office, I agreed that we would seek to appoint all of the nurses who had 3 years or more in their posts without a negative reference, without carrying them through the hornpipe for that appointment to be made. Mercifully, I'm told that almost 100 nurses have already been appointed. Similarly, we have agreed that we need to create another administrative level, another level within the nursing profession to stop nurses from having to go into administration in order to be paid better. Now, we've said the same thing, and we've had to pause on the one for the teaching profession for now, because the truth is that we have found a situation that has had a greater demand on the funds of the government than we might otherwise even have contemplated prior to the election. But to the extent that in spite of what we found, we are moving to create those positions, it tells you that we believe that the circumstances of the nurses and the hospital are important enough to have a very high claim on the government's purse. And to that extent, sir, whether it is in the form of a senior specialist nurse or whether it is in the form of a nursing practitioner, we have accepted that there has to be at least 2 other categories that go above the current positions of nurses in the hospital to allow persons who perform with excellence or who specialize to move to the next level without having to go into administration and lose them in the provision of nursing services in an acute care hospital. Now, these are the things that a government that has literally inherited an economic situation that had us with the 3rd highest debt in the Commonwealth, in the world, that we have come in, and in spite of all of the pressure, we tried to find the opportunities to be able to make it better as much and as far as we can. I met with the Minister in the Ministry of Finance, the Minister of Health, and the Chair of the QEH to be able to get us to a position where we can find the funding for an equipment package that has completely hobbled the operations of the hospital in circumstances where it ought not to have done so, given all of the money that was wasted, that was stolen, that was lost in all kinds of inappropriate practices in the last years of the last administration. And we wonder how we end up getting here. And if I were to say some of the things that boggle the mind, it might give people bad feels. But I have learned that the reason why people elected us is to get on with the job and fix it. And not to have to be making complaints to people all the time. I've said that it will not happen overnight. And that is why I started this debate by making the point that this is but one of the steps that we believe to be necessary to allow us to reach a position where we can hold the hospital accountable. The notion of an executive chair is well known even within our system already. The governor of the central bank is the executive chairman of the central bank.
Yes.
We just call him a governor. But he is the CEO and the chairman of the board. There are many, many other companies in the world and locally where the chairman is also the CEO. But I say this, to whom is given much responsibility, much authority, they also have responsibility. And we believe that the accountability of an executive chairman is in fact greater given the greater level of responsibility and authority in which we are investing in them. and that the opportunity, therefore, for seamless execution is what we are hoping to achieve. Now, I hope that we will be in a position equally that once the costings are done at the hospital, that the hospital can provide us billings for every patient, public patient, that they treat for us. And that the government is in a position then, along with whatever co-payments have to be made at whatever time, to be able to measure the quality of health care being delivered to an individual patient, and to measure where the improvements are coming month by month and year by year. We also hope that if we can settle the capital budget for the hospital and to raise the funds for both the equipment and major capital works that need to be done, that we can give the hospital the lift that it needs to be able to provide better services to the people of this country. And Mr. Deputy Speaker, I say so conscious that no appropriate institution in healthcare can function without an appropriate capital budget. They cannot. We are long past the days of physical examination and diagnosis, and that what we are also facing as a nation is that people's access to knowledge and information on the internet puts in them a desire for greater levels of care, even those that may not be available at all nationally, because they are aware that it is technologically possible in the world to achieve that level of care. Now, we have the unfortunate situation that the cost of health care has been perhaps one of the greatest escalating claims on the public purse in the last 25 years. And successive governments have spoken as to the need for us to appropriately address health financing. My own view is that it is one of the most important decisions that this government will make in its 5-year term. And we have appointed a health finance commissioner to help us collate all of the data, the research that was done by previous governments that has sat idly in the ministry, the continued conversations with both the private and public sector, and that we hope to be in a position, after consultation with the social partnership next year, to be able to sign off on what is the appropriate form of health funding in this country. As an interim measure in the budget of 2018, last year, I announced a measure that would see employees contribute, and the revenue that is being collected through the NIS for that levy works out to just on about $45 million, $46, $47 million it should be in a full year of collection. And those funds have helped to ease the pressure on central government with respect to the delivery of health care at the QEH. But we know that we need a more sustainable solution, and that measure, as I announced at the time, is an interim measure until we resolve what the final financing system for healthcare in this country will look like. And I say so conscious that there are so many efficiencies that I think we can develop. Now, I would like to see the day where your health data is owned by you as an individual, and that it is on a health information system that, irrespective of whether I am in Barbados or I am on a boat somewhere in the world or I am in another country, that persons can access my healthcare data in order to be able to make any kind of emergency intervention that is necessary for them to be able to do. but that means moving to a different level. I want to see the day when the polyclinics are so appropriately integrated with the hospital that the diagnostic capacity of the polyclinics is significantly expanded, because we have an integrated system that allows for the imaging and reading to take place in different places from where the patient may be. I want to see the day when we have a healthcare system that is not premised on what we deliver only at the QEH, but through negotiations and contractual arrangements that we treat to the entire health campus of Belleville and Beckles Road, across to the new clinics that people are discussing with us. Because at the end of the day, if we can create a seamless system that allows us to be able to better leverage what we have both publicly and privately, but recognizing that affordable access to quality health care must be the hallmark, then we will be in a position to remove a number of things from the conversations that attach and surround our healthcare system. I am tired of hearing about people who cannot get their operations done on time and who have had to wait 6 months and 9 months and 12 months and 18 months for basic gynecological operations, for basic hernias. It's not right. And I've said to the Minister of Health, and I've said to the hospital administration, that if we have 11 or 12 operating theaters, then let us work out a proper arrangement such that we make those available to who may want to operate within it, on the basis that 25 or 30% of the operating theater time can be used privately, and the rest of it is used to the max for public patients. I've said to it that we need to fill the gaps. It makes no sense having beds in MICU in rooms that cannot be used because we have no nurses. Now, the fact that we are moving to fill this with dispatch within less than 18 months in government, but they existed there for how many years before? And I ask myself, at what point did people feel motivated to correct these issues? Now, we are trying to correct this while trying to fix so many other critical issues to the functioning of this society. How do you have a Bridgetown port that was only scanning 6% of the goods coming through the port for years? 6%. And a then Attorney General in the last government telling you that he no guns coming through the port and nothing was being done about it. How do you have a government not buy a single sanitation truck, a single bus for 10 years? But yet the debt goes from 6 billion to their 15 billion. And you don't buy any additional equipment for the hospital other than what we signed off on at the end of 2007 to be borrowed from the NIS as a $30 million package, I believe it was at the time. How do you have a government that increases the debt of the country by near $9 billion? Bill. Not mill. Bill as in Bill Clinton, billion. Not M as in Mia.
Billion.
Increases that.
$1 billion.
And the hospital remains in the state that it is today. I ask this Honourable Chamber to support us with this. We will be held accountable by what we do. And we do not ask for any quarter, but we shall not give any. I am buoyed that this approach to accountability is one that has endured many generations of Barbadians. And I believe that the Minister of Health had cause earlier to quote from a document called the Queen Elizabeth Hospital, Ministry of Health and National Insurance, Barbados, the first 15 years, 1964 to 1979. I believe that the then Minister was a now retired and distinguished member of the city of Bridgetown, Dame Billy Miller. And the editorial was signed by a gentleman called Errol Waldron, who is now Sir Errol Waldron, Ina Walters, and James Williams, who was the then director at the time. And it struck me as I read it last night, because the first sentence in the editorial says it all. And it is the story of what was missing in the last decade, and I trust and pray it will be the story of what will be returned in the next decade. Important institutions in a community need to present themselves to the public for scrutiny. When the institution is one like the Queen Elizabeth Hospital, which spends a large portion of government's revenue, then it is vital that the public sees the institution at work so that it can judge for itself the contribution which the institution makes to the community. That simple premise of accountability and transparency is what was missing at the hospital. And I make bold to say that if we do nothing else, I might not be able to lead a government that can afford to build $1 billion building for a new hospital. But I hope that I can lead a government that can change the delivery of health care for the better to the people of this nation, that can add value to what we do in the delivery of health care, that can make a meaningful difference to ordinary people being able to sleep easier, have less pain, and to get the quality delivery of health care when they need it in clean and appropriately managed environment without us having to spend the kind of money that we saw the last government spend in buildings just to say that they could admire the edifice, even if the steel could not be immediately apparent that lay within the buildings. This is too fundamental an issue for us as a people now. And everyone has a role to play in the changing of the culture of the institution. The minister knows how I feel about us being able to facilitate more and to reach out and communicate more, because at the end of the day, half the time when people are ill, their families want what first? Communication. And they want to know that we are trying our best. They don't expect miracles. And 90% of the time, I must tell you, that they are complimentary of the quality of care at both the level of the doctors and the nurses and the ancillary staff in the hospital. But what has happened is that if you underprovide for an institution $50 million a year by 10 years, you have underprovided by $500 million. And that underprovision by $500 million will see itself in ceiling tiles that are missing in a hospital that's supposed to be a sterile environment. Will see itself in equipment that is malfunctioning. Will see itself in the inability to have and keep proper spares and other pieces of equipment that are necessary. Will see itself in an inability to deal with consumables. And what hurts me about what has happened in the last few months is that it was not because of lack of equipment, lack of money. No. It was because of lack of management. And people, for whatever reasons, not coming to work every day because they either resigned early, resigned later than early, but not at work, because they were on protracted sick leave, and fundamental tasks that are critical to management not being able to be appropriately fulfilled because you cannot take action against anybody who is on sick leave. The Minister of Labour will tell you that our laws don't allow it. So a whole country gets held to ransom, and the board and the rest of the management team do its best to work around that. But nevertheless, still hobbled, because when all is said and done, the law places certain responsibilities in different functionaries at law. So I pray that we can start to turn the corner. I pray that we can work with the staff, because like with everything else, I have been very upfront about this. This government will not win this battle on its own. Will not. But together, the people of Barbados working as one. Government, labor, private sector, church, civil society. Not everybody, but the majority of us working as one can turn this country back around and carry us back to the days when people clamored to come to the Queen Elizabeth Hospital from the rest of the region, because they knew that the quality of health care was second to none in the Caribbean. I have every confidence in my minister, and I have every confidence in the board at the hospital at this point in time, but they also know that I do not mince words if they drop the ball. And if at any time they drop the ball, we're going to have difficult conversations, but we will always, at all times, keep the patient and the delivery of quality health care at the forefront of our considerations as a government, because that is what matters to the people of this country who cannot afford better. So, Mr. Deputy Speaker, I thank you for the opportunity. I was wise in not promising to speak long or short, but suffice it to say that I hope that I've just shared a few thoughts, and that an opportunity will come back again. I look forward to it in the estimates of next year, because I believe that this area, I've said that agriculture and healthcare for too long have been treated as the stepchildren of an independent Barbados, and that they cannot continue to be treated as if they are just an also-ran or just out there, and that we have to address the problems that we've inherited in both sectors frontally and try to reposition this country in being able to improve the systems in both of these two sectors. I'm obliged to you, sir.
Thank you. Member for the City of Bridgetown.
Thank you, Mr. Deputy Speaker. In wrapping up, I think I would certainly like to thank all honourable members for the robust discussions and presentations that were made today. A number of issues were raised by several of you, and I have taken note of all of the concerns. Some will be addressed later. I will speak to just a few in my wrap-up, because some of them were actually spoken to by the Honourable Prime Minister, especially in relation to the equipment problems that we have at the QEH, and a number of those were raised here today. I also thank the Honourable Member for St. Michael South Central, who spoke to the issue of the health services contribution and the fact that the Queen Elizabeth Hospital has been in receipt of an average of $4 million per month, so that they have been able to plan how to execute the work there. And I must add to what the Prime Minister said by saying, and this is absolutely so, that the shortages of basic supplies that were mentioned by the Honourable Member for St. Michael West, the Honourable Leader of the Opposition, that those matters have not resulted through the lack of funding, but there are other issues, systemic and other issues, which the board of the Queen Elizabeth Hospital is working on assiduously, including bringing in a private company to deal with procurement and matters of this sort. So those issues are being taken care of at this time. The matters raised in relation to the operating theaters and I believe the AC problems, I'm happy to report to this Honourable Chamber that those matters were significantly addressed recently. And in fact, except for operating theater number 6, all of the ACs in the operating theaters are working, including the 2 obstetric theaters where there are no issues. So that matter has been addressed. Hospital infections, I must speak to this. One of the first things that I recognized when I visited the Queen Elizabeth Hospital several months ago was the fact that there was a relatively young doctor who is responsible for infections control at the QEH, who is extremely knowledgeable, very passionate about his job, and he has a very, very good team working with him. And in investigating the issues that were raised, I am satisfied, as he has indicated to me, that we do not have an issue at the hospital with hospital-acquired infections. And in fact, at the QEH, they are quite low at this time. There's a good surveillance program, and there's constant dialogue between the hospital staff, the ward staff, and the infection control persons. But there is a problem, and that problem, I am advised, is called MRSA, and I will attempt to pronounce that for you. It's methicillin-resistant Staphylococcus aureus. That sounds good. But it's a bad bug resulting from the inappropriate use of antibiotics in the community, and this causes bad skin and deeper infections, especially for patients in hospitals, but it is rampant on the outside of the hospital, and that is something that they are grappling with. When they say outside of the hospital, sorry, that is in the community, not outside, all across, yes. So that is being addressed in a serious way. The issue of leptospirosis was raised again by the Honourable Leader of the Opposition. I must admit, and it is true, I mean, it is obvious to every Barbadian that we have a problem with rodents. There's no question about it, and we actually initiated a national campaign a few months ago. But the incidence of leptospirosis, there's no evidence to suggest that there has been an increase or that we have any significant problems there. In fact, for the last 5 years, there have been about 74 recorded cases of leptospirosis in Barbados with 3 resulting deaths. And we have been monitoring this very seriously because given the increase in the rodent population, we do have that concern. But I can assure this chamber and assure fellow citizens that this is a matter that we are watching and that we do not have anything to worry about at this point in time. In terms of the rodent program and the fight against what, yes, I admit they're kind of large these days from all reports that we have received. The Ministry of Health and Wellness is now back in possession of the appropriate rat bait. We had a little bit of a problem in terms of the supplier, and I would also like to thank the private sector entities, 2 of them that I will not call their name, but we've been able to get some assistance to be able to purchase a lot more rat bait and some rat bait with a higher potency, and that operation is ongoing. The matter raised in relation to the security situation in terms of persons having to traverse between the car park, especially at night, to the accident and emergency and other areas, that is an issue, I will admit, and that is one that I will have a discussion with the board, and that is something that we should be able to deal with, and we will deal with that. The short stay unit, that was a good intervention coming from the board, but I agree because if they're sharing the same staff as accident and emergency and the same equipment, then the sustainability of that initiative obviously would have been compromised, and that obviously something that we will have to rethink. The 24-hour service that was raised by my honourable colleague from St. Philip's South. The issue of training of staff there, let me assure you that before we opened the polyclinic service at Winston Scott, all of the physicians and nursing staff that were allocated initially to St. John and to Orange were actually trained. They undertook a training course by the Accident and Emergency Department of the QAH in emergency management to be able to facilitate the work that they were expected to do at the polyclinic. I will admit that having had some discussions recently with some physicians from the accident and emergency, that perhaps we could have, and we can still correct that, have some attachment, some short-term attachment at the accident and emergency to help strengthen the level of operations and confidence within that area. The issue, however, is that within the wider polyclinic system, there's still too many referrals coming from the polyclinics to accident and emergency, and that suggests to us that we may need to extend that training beyond the 24-hour service to the entire primary health care service in Barbados to be able to really take the load off of the accident and emergency. The Honourable Prime Minister would have spoken to the issue of the advancement for nurses, and I can assure you that we are pursuing that. I know the Prime Minister has spoken to 10 specialist nurse positions and the family nurse practitioner, and we are working on the curriculum in conjunction and collaboration with the University of the West Indies, with Ross and with others, and including PAHO. And I must say that while in Washington for the PAHO meetings, the acting Chief Medical Officer and myself were able to visit the Howard University Hospital, and I actually got the opportunity to see a nurse, a family nurse practitioner in operation, and to have some discussions with that lady, and I am satisfied that we are going in the right direction in terms of creating and filling that post. The Honourable Member for St. Michael South spoke to wellness. No, not St. Michael South, it was St. Peter, I'm sorry. Spoke to wellness, and he's right. And the Ministry of Health and Wellness, really, we've been accelerating the whole question of wellness, and in time to come, not in the not too distant future, we will be revealing some serious plans and initiatives that we have in terms of promoting wellness and trying to deal with the NCD problems. But we have started through the Queen Elizabeth Hospital and an initiative from the Prime Minister to get the hospital to be able to create a program for the lack of a better term at this moment, community aids to be based in the polyclinic system, to be able to go into the communities to help patients with NCDs to manage the NCD situation, and for those who are unaware, to be able to spread the message and promote healthy living within communities. In addition to that, we are pursuing the offer made by the Prime Minister for wellness grants to be allocated to persons recommended by physicians that they are treating. Plan it out, yes, the planning out of the grant, the financing of it will have to come from the Ministry of Finance on a proposal and recommendation from the Ministry of Health and Wellness. And this is a project that we are looking to be able to execute next year. So those were the major things that I wanted to raise. The others are important as well, but I've taken note, copious notes, and I will be discussing with the board of the Queen Elizabeth Hospital in due course so that we can rectify any of the issues that require that action. So once again, thank you very much, those of you who have contributed to this debate. And Mr. Deputy Chair, I beg to move that you do now leave the chair.
Read the second time.
I did that already.
You got to say.
Okay.
Go repeat it.
Okay. Mr. Deputy Chair, I beg to move Mr. Deputy Speaker, I beg to move that the bill be read a second time.
Seconded. Seconded. The question is that this bill be read a second time. All members in favor say aye. Those against say no. Think the ayes have it.
Mr. Deputy Speaker, I beg that you do now leave the chair and that the House resolve itself into committee for further consideration of this bill.
Can we have a seconded, please? Beg is seconded. The question is that I do not leave the chair and this House resolve itself in committee for further consideration of this bill. All members in favor say aye. Those against say no. I think the ayes have it.
This House is now in committee.
Clause 1.
Madam Chair, I beg to move that Clause 1 stand par.
Question is that Clause 1 stand par. All honourable members in favour, please say aye. All honourable members against, please say nay. Methinks the ayes have it.
Clause 2.
Madam Chair, I beg to move that Clause 2 stand par.
Question is that Clause 2 stand par. All honourable members in favour, please say aye. All honourable members against, please say nay. Methinks the ayes have it.
Clause 3.
Madam Chair, I beg to move that Clause 3 stand par.
Question is that Clause 3 stand par. All honourable members in favour, please say aye. All honourable members against, please say nay. Methinks the ayes have it.
Clause 4.
Madam Chair, I beg to move that Clause 4 stand par.
Question is that Clause 4 stand par. All honourable members in favour, please say aye. All honourable members against, please say nay. Methinks the ayes have it.
Clause 5.
Madam Chair, I beg to move that Clause 5 stand par.
Question is that Clause 5 stand par. All honourable members in favour, please say aye. All honourable members against, please say nay. Methinks the ayes have it.
Clause 6.
Madam Chair, I beg to move that Clause 6 stand par.
Question is that Clause 6 stand par. All honourable members in favour, please say aye. All honourable members against, please say nay. Methinks the ayes have it.
Schedule.
Madam Chair, I beg to move that the schedule be the schedule to the bill.
Question is that the schedule be the schedule to the bill. All honourable members in favour, please say aye. All honourable members against, please say nay. Methinks the ayes have it.
Madam Chair, I beg to move that you do now report to His Honour the Deputy Speaker the passing of one bill in committee.
Question is that I do now report to His Honour the Deputy Speaker the passing of one bill in committee. All honourable members in favour, please say aye. All honourable members against, please say nay. Methinks the ayes have it.
Tops. I just sent you some maybe look at.
The chairman of committees have reported to me the passing of one bill in committee.
Mr. Deputy Speaker, I beg to move that this bill be now read a third time.
The question is that this bill be read a third time. All those other members in favour say aye. Those against say no. I think the ayes have it.
Mr. Deputy Speaker, I beg to move that this bill be now passed and cited as the Queen Elizabeth Hospital Amendment Act 2019.
The question is that this bill be now passed and be so cited. All those honourable members in favour say aye. It wasn't seconded? Seconded. Okay. The question is that this bill be now passed and be so cited. All members in favour say aye. Those against say no. I think the ayes have it. This bill is now passed and so cited.
Mr. Deputy Speaker, that brings us to the end of government business for the day. And I now beg to move that the House be adjourned until Tuesday, 22nd of October at 10 a.m. in the forenoon.
Okay. Somebody second it? Right. The question is that this House be now adjourned until Tuesday, the 22nd of October at 10 o'clock in the morning. All members in favour say aye. Those against say no. I think the ayes have it. This House is now adjourned until Tuesday the 22nd of October at 10 o'clock in the morning.